Beech Brook has been supporting schools and school districts since 1974. In fact, Beech Brook and Cleveland Public Schools were the first of its kind partnership in the United States. And we support schools by embedding clinicians and mental health professionals in the school where kids spend most of their time during the school year. It creates a better learning environment for all of the kids, not just the kids that we work with. It slows teacher burnout, and it also saves school districts money along the way.
It's very hard to get into outside services. They have lines that are so long, they'll be waiting for months. We eliminate that barrier so we can get access sooner, and that is so important in the mental health world.
The Beech Brook has been a great partner to the Twinsburg City School District. They've been in our district for a number of years now. Having that built into our school day, so our students can meet with one of our Beech Brook social workers first period of the morning and start off their day in a bright way, or they can check in with them before they leave for the end of the day.
We've definitely seen an increased need for mental health services, and the school district definitely recognizes that, and they see the need and they are rising to that.
When that happens, the Beech Brook team just mobilizes, and it's amazing. All of a sudden there's 10 people in our buildings, and they're here to support our students. Trauma doesn't go away after a week. I say that so we, in 3 weeks later, or 2 weeks later, or whenever, even a year later, when those feelings pop up again, they know that our staff's here, and they can keep working with them.
So I think this really does prevent them from having future issues, and those are very costly issues. Hospitalizations, jails, it gets very expensive, and that's a very big drain on the community when we're already trying to scramble for resources.
When we told her about my diagnosis, she really shut down, and she wasn't talking to me and she wasn't talking to her father. To know that there were services right in her school that she could access if she needed them was, it was a relief. It felt like she had a team immediately, which was amazing.
I just couldn't get over the idea that my mom was sick, and I just had a lot of anxiety about that. So I talked to Christine, and she really helped me with that.
My primary concern was providing a safe, comfortable space for her, getting to know her so she felt comfortable to talk about anything she was struggling with.
I liked the grounding skill, where you find things around the room and it's 5 things you can see, 5 things you can touch, 4 things you can feel, 3 things you can smell, 2 things you can taste, and 1 thing you can feel.
I don't know that there's anything more critical than making sure our children are happy and healthy, and to have people on the ground in our schools taking care of that it's everything.
I love seeing the students grow. It was such an honor to see Sylvia today, and I love that I can help support them from 4th grade through 6th grade and then know that they're supported after they leave my building.
I feel like everybody was so helpful, and they taught me so many things that even if it's a different situation or she gets sick again, I can still apply those coping skills that they really helped me with, because it wasn't just an experience, it was kind of a learning lesson.
Beech Brook was a godsend for our family. It was really a time of crisis for us, and we needed support. Sylvia was only in 3rd grade, and she was a happy, confident, smart child, and I am really happy to say that my diagnosis and what we went through didn't take that light out of her. That's still who she is today, and I really credit Beech Brook with that.